and hello everyone. My name is Natasha Nadhirah. So today me and my partner Muhammad IJMAL are going to talk about substance abuse, specifically tobacco addiction. So first, let's look at the definitions of substance abuse. Substance abuse refers to the misuse or harmful use of any psychoactive substances, including alcohol, caffeine, nicotine, marijuana, and any other drugs out there that can influence the way our brain functions. So this also includes tobacco. Tobacco is a plant that contains a high amount of nicotine, and when people consume tobacco, this psychoactive substance can have influence on the person's mind, mood, and behavior. So the tobacco leaves are being cured, aged, and processed differently after being harvested. So this makes it possible for the psychoactive substance to be consumed differently, which include through smoking, which is via cigarettes, cigars, and pipes, or by applying it to the gum, which is by dipping or chewing, and lastly by inhalation, or we call it sniffing. According to the National Health and Mobility Survey 2019, they found that approximately 4.9 million Malaysian adults aged 15 years old and above were current smokers, with male being the significantly higher amount than the females. With this overwhelmingly high number of individuals, there are some risks and effects of tobacco use and addiction that we should pay attention on. So as we know, extensive use of tobacco can lead to the tobacco or nicotine addiction. So when people start to use tobacco on daily basis, this will have a great impact on their health. For example, the way their brain functions, as their brain will be functioning more slowly due to the increased amount of carbon monoxide and the reduction amount of oxygen. Other than that, their breath also will be affected and their teeth will start yellowish. They also will experience difficulty in breathing and fatigue when doing any activities. In the long run, tobacco use can lead to ulcer, heart and lung diseases, stroke, and also cancer. However, not only that the smokers that are vulnerable to these effects of tobacco, the non-users are also at risk. In another study, it is found that smoking could increase the epigenetic age of human respiratory organs, but the effect varies among organs and that the effect can be reversed through smoking cessation. It is also found that the epigenetic age of the airway cells could increase at an average of 4.9 years and that lung tissues at 4.3 years.
Let's talk about the prognosis. In general, the outlook for smokers have given more detrimental effect than benefit for them. According to the Center for Disease Control and Prevention (CDC), active smokers have a 10-year shorter life expectancy than non-smoker. Smoking cessation before the age of 40 minimizes the chance of dying from a smoking-related disease by 90%. If people continue to take it, the brain's biological function may impact their health in terms of how they behave and make the decisions. The ability to learn new things or to cope with stress will be affected in some way. Moreover, smoking cessation is associated with improved cognitive function, psychological well-being, and self-esteem. In addition, according to Karimton and colleagues' study, smoking cessation after a lung cancer diagnosis is linked to more effective treatment and a better prognosis, as it would increase survival time and improve response to chemotherapy and radiation. If someone asks, is there a chance that the addiction will reactivate again? People in recovery from this addiction have a higher likelihood of relapsing even years after they stop using it. If left untreated, smoking can be fatal. Hence, treatment intervention can help in the recovery of the addiction and prevent serious consequences. When we talk about intervention, there are a variety of nicotine replacement therapy that have been approved, like gum, patch, nasal spray, oral inhaler, and medication including varenicline and bupropion that help people quit smoking. The user must first understand that quitting smoking will result in a withdrawal syndrome, irritability, anxiety, and bodily symptoms including headache and exhaustion of some of the side effects of nicotine withdrawal. the withdrawal symptom, it will be critical during the first week, but will ease as time goes on. However, even when withdrawal symptoms have subsided, unexpected impulses are typical. For this reason, learning discipline is crucial. Combination of intervention are more effective than single approaches, and the combination of medication with behavioral intervention will be more effective. Non-pharmacological intervention like group therapy, individual counseling, and telephone counseling have all been shown to successful ways of delivering behavioral support for smoking cessation. Among non-pharmacological intervention, counseling is the most frequently used approach, and others include mindfulness-based approaches, cognitive behavioral therapy (CBT), behavioral activation therapy, and motivational interviewing. There are also alternatives that help to stop smoking. For instance, mind-body therapies such as meditation, Qigong, Tai Chi, and yoga focus on the interaction among brain, mind, body, and behavior to affect physical functioning and promote health. As part of the yoga practice or a meditation, paying attention to the breath cycle and deep breath for coping with withdrawal symptoms during smoking cessation. Exercise and movement can help to enhance mood, reduce negative effect, and decrease the severity of withdrawal symptoms. The practice of mindfulness and meditation is also an important aspect of intervention. Trait mindfulness has been positively associated with smoking cessation self-efficacy. I will also recommend some tips to confront the urge to smoke, delay when the urge comes, even for a short while. Drink more water, deep breathing, write out a list of reasons to quit and display it prominently, for example, on the wall. Then, get rid of all tobacco products, lighters, matches from all areas, clean all clothes in order to remove cigarette smell, and enlist the support of non-smoking friends, relatives, and workmates. Thank you.